Hello, Dr. Cimino. Welcome again. Thanks for joining us. We're going to talk surgical guides with Exoplan today. So just love to hear, you're just beginning your journey with Exoplan and using it. Love to just hear about, the learning curve and learning Exoplan and just how you plan to use it with, prosthetically driven implant planning. So yeah, just talk to us. What do we got here, and where are you at in your journey? And then let's maybe design a case together.
Awesome. Thanks, Rob. Thanks for having me back. The Exoplan is another version of Exocad, but it's planning software for implant surgeries. And as someone who loves CAD dentistry, someone who loves digital dentistry, the next obvious step for me was to start planning my own surgical guides for implant placement rather than relying on having someone design it for me and then waiting to get it back. I can design it within minutes, get it on the printer and print it, and we can be placing an implant day of or next day, which is pretty awesome. So if you've used Exocad for a while, Exoplan will be really easy. It's like riding a bike.
Awesome. Awesome. So why don't we jump in and design a case together, and then we'll just talk through it and have some fun.
Awesome. So today we're going to plan an implant at site 12 with Exoplan, and I've got 2 adjacent teeth marked and the tooth that we're going to be placing an implant at site 12.
Awesome. And would you say you're going to be using Exoplan for pretty much all of your implant placements?
From here on out, yes. Unless it's going to be a more complicated situation where I feel it'd be best to have in the hands of someone with a lot more experience with that. But for me, single implant or 2 implants is easily doable in the GP office.
So, Dr. Cimino, using Exoplan here, and I'll walk through a case. Are you using this on all of your implant cases here moving forward?
Yes. Placing singles, maybe multiples, and it works great. I can plan a case pretty quickly, get it on the printer, and we can see someone place an implant to either same day or next day.
Amazing. All right, walk us through Exoplan and how you're using it and what you like so far.
Awesome. So we just uploaded the CT scan, and now it's showing us the arch and the panoramic view. And now at this point, we're going to align the soft tissue mesh, and I'm going to bring that file in. Now there's a couple of ways that you can mesh these two together. You can click some points on your soft tissue and bring it over here to the CT scan, or you can clip the CT scan so that you can see the occlusal surfaces in some areas, and you can merge them together. So I'm going to click a spot that I can see here and there. So three points.
3-point alignment through the slices.
And then just like an Exocad, it'll do it'll do like a perfect fit, and it'll show you a color map on how well it aligns. And so this one's pretty good. You've got some blues in there. Now, if you didn't like it, you can always back out of it and redo it. You can continue with and accept the alignment, or you can continue without accepting the alignment, which I don't see why you want to do that. Or you can back it up and you can try to realign it. So if we didn't like that one, let's go back and realign. Let's do it a different way this time. Let's clear all the markers. Let's just mark the facial. And then try that. Try it that way. It came out pretty much the same. So we've
Yeah,
got
it came out
blues
pretty
in
good.
here, so I think that's a pretty good match.
Awesome.
And you over here on the right side of the screen, you've got different cut views, and you can see how well your STL lines up.
So you can like double check the alignment, just make sure everything looks good.
So now we're going to pick where we want to place the implant. So we're going to select number 12, and I'm going to select abutment or screw retain, but I'll decide later.
What's your current favorite implant system you like using?
Right now I'm placing Nobel and using the conical connection parallel.
Is that just the one you're most familiar with, or you just like the way it behaves?
You know, I've placed Strawman, I've placed Astra, I've placed BioHorizon, and you know, my current flavor right now is just Nobel.
Cool. Awesome.
So just like an Exocad, we're going to place a tooth model. And you really don't need to be too picky at this stage with what tooth you're picking. You can just put a generic tooth in here. But just for fun, I mean, we can change it up a little bit. And we can select just a generic smooth. And again, just like an Exocad, you can start moving this tooth around and positioning it. You can also bring in your opposing arch, and we can do that now. So let me go to expert mode. Add or remove a mesh. We're going to bring in the antagonist. And then it automatically aligns the bite because these two files were scanned together. I'm going to hop back to the wizard mode, and now I have the opposing. But again, I'm not trying to design a crown here. I just want to put a tooth in place so that I know at what angle I want to place my implant, and I want it to come out relatively close to the occlusal surface.
So it's just getting it just close enough to be a good reference point for implant position
Correct. Yeah.
and screw channel angulation.
So now I'm going to select my implant. So I have Nobel implants uploaded here. You'll have, if you want other implants, you'll have to download the libraries for it. So Nobel Parallel, conical connection. And you can always change the size. So picking the size right now doesn't matter, but let's start with a 4.3 by 13. And you can place the implant here on this cut view. It gives a safety zone around it. You can turn that off. And then I can start rotating the implant to fit within the bone of where I want to place it. You can see it in the panoramic view, and you can move it around there, or I can move it here also. So I can
Nice.
want to line it up with emerging from the occlusal surface.
And is this a bone level implant?
It is. It's a bone level implant.
How do you manage tissue emergence with your implant placement?
In regards to how deep I go, or
So you place the top of the platform of the implant would ideally be at bone level, and then now you've got an emergence. Do you use like any special healing caps for
oh,
managing the tissue profile?
I prefer to bury. I'll bury my implants. Now, when before I place the implant and I've completed the osteotomy, I will. There's a burr you use to actually open up the coronal aspect of the crest of the bone, and then we'll place the implant. I flap. I don't do a hole punch on these cases. I'll flap. I'll start with the first drill and without flapping, and then I'll take the guide off, visualize it. You can even put a little marker in there and take an X-ray just to verify you're where you need to be, and then from there I'll flap it and then continue with the osteotomy, and then I'll place the implant and I'll visually see where I'm at when I'm placing the implant from the flap, and then I'll just put a cover screw over it and close it up. I find
Nice.
that that's the least amount of risk, especially on posteriors. And if they want a tooth there, then I've got a great way to make an in-house Essex retainer rather than just doing a suck down and trying to fill up your missing ponic tooth with resin and wasting all your resin. You can on Exocad you can design a ponic and you can print that, and then it just snaps into the Essex retainer, and you can even bond that in, and it'll hold pretty well. And I my patients love that. There's no complaints about it. They fit great, and you can leave enough space for soft tissue healing.
Nice.
So it looks like we're a little close to the buckle, so let's bring it back a little bit. We can see we're pretty good over the occlusal surface. Let's look at it in 3 dimensions. And we can even see where it's going to be emerging out of the occlusal surface there. So if you're happy with your placement at this point, now it's time to add the sleeve.
Will this one need a angulated screw channel or no?
I think it will, um, but let's see.
When do you have to make that determination?
Once you can see where the implant's going to emerge out of the occlusal surface, um, but all that's determined on kind of where you're putting your presumptive crown. And it looks like we placed our crown in a pretty good spot. So, and we've got plenty of bone around our implant. You can. So it looks like it's coming out of the occlusal surface, so we may not need an angulated screw channel.
Awesome.
And Exocad wants to let everybody know that, they're not responsible, so you have to agree to their terms.
Yeah, of course.
And it's going to write a surgical report. And at this point, you can technically be done with your planning if you don't want to print a guide. But we want to design a guide, so let's move to the next step.
Yeah, so if you just wanted to plan, you could plan here and then go freehand once you've made some decisions on size and of the implant
Right,
position, and then
right.
if you want a guide, then we'll proceed.
So this is where we're going to do our virtual bottom here for the guide. And now we can start marking how we want to design our guide. So let's start marking.
Yeah, how much do you like engage the teeth? Or is there like a remove undercut option so you get a nice passive fit in the guide?
Yeah, so that's what that previous step was creating like that virtual wax up bottom, and that way eliminates the undercuts. And you don't want your guide to be super tight, like a fitted night guard. You want it to
Yeah.
get on there because you don't want to struggle to get it in and out where you're trying to get your your drills out and everything like that. Um, but one tip that a little pro tip I could give everybody is don't waste your money on buying if you're printing in house. Don't buy the surgical guide material and outfit it with a tray of its own. Just use your night guard material because it's the same material.
Okay. I think clinicians might be allowed to do that, but I don't know if labs are allowed to do that.
Probably, you're right. Probably not. Uh, so what these boxes are, you can see through them, is they're little cutouts in the guide, so you know that you're fully seated before you start doing your drilling your osteotomy.
Yeah, seating window so you know that it's there's no gaps between the teeth and the
Right.
guide.
So I like to add at least two on either side. That way I know we're seated. Now, and we can bulk things up where you feel like you're a little lacking in thickness. I'm just going to add some strength here and bulk all this up, and then you can go back and smooth it. And Rob, this would be the area where maybe we could throw our sleeve back in there and see if we can make a stop for that sleeve. So let's add. So it actually will not let you add material there.
Hmm.
So there's your answer.
Well, my guess is there's probably a workaround somewhere out there on the interweb. So maybe if anyone's watching this video and if there's a way to make a sleeve stop, be curious on that. I'll ask some of my friends. But yeah, my guess is it's preventing you from getting material in there on purpose in this phase.
And if you're happy with everything, then you're done. And
So, and as a general dentist, how long did it take you to learn Exoplan, and then how many cases have you designed, and what's your current like design time per case?
well, I've been using Exocad for 2+ years now, and Exoplan is really similar. And if you're familiar just with using your own CT scan in your office and placing implants on that software, this is a walk in the park. In fact, it's so much easier than a lot of the CBCT softwares that are out there. And you've got a full library of implants to choose from and then design a guide. I know all of these CBCT softwares, when you buy your CT, they provide you with implant planning software, but all you're really doing is picking the size and putting the implant in a position. With this one, you can go further and actually plan a real guide, which is so much better. And how long did it take me the first time I did this? I played around with it quite a bit, tried to get familiar with all of the parts and everything, but it probably took me an hour the first time, and then going the second time, now I was more familiar with it. maybe 30 minutes, depending on the challenging parts of the case. But I think the more you do it, you could probably plan a case in 15 minutes or less and have a guide ready to go.
Amazing. And so you're using the Sprint Ray printer with night guard resin for your guides?
Correct. Yeah. And then you just get your sleeves from your implant rep.
And then what is this saving you? Like, so your surgical appointment, is it saving you time or just giving you confidence in your flow using this process?
Yeah, the confidence for placing that implant exactly where I want to put it for not only restorative purposes but anatomically, and know that I'm putting it right where I want to around some vital structures like you know, a canal or something like that. That confidence is just it makes everything so much smoother at the time of placing the implant. But you also have to know how to deal with complications. Let's say the bone is not quite as hard as you anticipated, or the implant's a spinner, so you need to know how to maybe you need to step up a size or something like that. And then, of course, with all this planning, okay, I do have a good bit of volume of bone. Maybe you underplan it. You plan something a little bit smaller if the bone's soft, but you plan on placing something a little bit larger. But yeah, it saves so much time chairside and cost wise. I mean, a lot of people are sending their CTs and files to planning companies and spending 250 to 300, and on top of that getting a guide printed and cost of the sleeve and things. It just starts to add up. And in today's dentistry, where a lot of providers are in contract with insurance companies, every dollar counts. So this right here can save you a lot, and you can get the treatment on the books faster because you know that I can get that guide planned and printed in a matter of 24 hours, and we can see them tomorrow.
Yeah. How helpful is the CT data in giving you bone density and giving you some guidance on the size and the shape of the implant based upon the bone density?
Yeah, so even the basics CBCTs will give you bone density. Now, how accurate are they? I've definitely had cases where I thought the bone was a lot harder. Thought we were going to have D1, D2 bone, and it ends up just feeling like styrofoam when you get in there. And then vice versa. I thought, okay, it looks like this is going to be some soft bone, and I had to really adjust things just to get the implant in place because the bone was so dense. So I don't think as accurate as our CBCTs are today. They're not 100%, and you have to be able to alter things as you go, and that just comes, I think, with experience.
Yeah. Awesome. Anything else you want to say? Any other tips on Exoplan here?
Yes. So a couple of things about this whole software is that you can kind of incorporate both Exocad and Exoplan into your workflows. And let's say, for example, you have a case where you're going to do an extraction and immediate implant. You can take the file or the STL file on Exocad, and you can extract the tooth, and then you can turn that file into an STL file or a mesh and bring that into your Exoplan software. Now the tooth is extracted, but you can also bring in as a pre-scan and put the existing tooth that was there back in. So now you don't have to put in any of these ponic teeth. You can put in the real tooth. And that way you know that we're in the right spot, and then for your implant planning and that kind of stuff. So there's a lot of cool things that you can incorporate both Exocad and Exoplan and do things with a lot of accuracy, which I think is pretty neat. So I'm excited to have Exoplan, and if there's anybody there that is on the fence about using Exocad or Exoplan, please reach out to Rebel 3D and get in touch with me. I'm happy to go over it with you. We could do a session, and I could walk you through everything.
Yeah, rebel3d.com/Michael. And you're available to help anyone, any doctors or technicians that want to get familiar. This is fantastic.
Absolutely. Yeah. Happy to share.
Awesome. Can't wait to see more. Thank you, Dr. Michael.
Thanks, Rob.